Hey, Margie here. Are you ready to learn some great tips for your bones and overall health? Well, if so, you're in for a real treat today because guess who your guest speaker is? Me. But I'm changing things up a bit and I'm being interviewed by my husband, Craig Bissinger. And Craig's an OBGYN who's been working with lots of women for many years. And he really has some great insights because I'm hosting the Natural Approaches to Osteoporosis and Bone Health Summit starting January 17th. So I've been doing around 46 interviews with great experts, and we've been discussing some of the new things that I've learned. And Craig really brought up some really great topics and really great information that he's been able to really share with his patients. So we're going to just share that with you because I didn't want to wait till January 17th for you to have to learn about all this new information. So anyway, stay tuned. Welcome, Craig, to the podcast.
Thanks, Margie. I'm really excited to be here with you this afternoon talking about this really interesting subjects that we came across during the 46 interviews that you did for the summit. I'm really happy that you finally finished those interviews because I get a chance to see a little bit more. This may be one of the few times I've actually got a chance to see my wife in a while. Hi, Margie. Anyway, we did learn. I did learn a lot. And I know Margie learned a lot from these knowledgeable speakers on lots of different topics in the world of osteoporosis and a natural approach. Of course, I look at things more from a physician approach. And so we're going to start off with talking about a few of the things that were a little surprising to me along the way. And first off, I want to talk a little bit about the depression medications. We're getting around the holiday season, and it's a stressful time of year, of course. And a lot of my patients, unfortunately, have been and still are on antidepressants. Can you speak a little bit about the role?
Yeah, it was really interesting because Dr. John Neustadt discussed medications and which medications can actually cause osteoporosis. And one of the ones he said that physicians don't tell their patients that this is a side effect is antidepressants. And people can be on antidepressants for years and years, never knowing that this can actually be a cause of bone loss and increase in fractures. And so the important thing that Dr. Neustadt said was really whenever you go on any medication, always ask for the side effects, but then talk to your pharmacist because the pharmacist is the one who truly knows all the different side effects. But if you have osteoporosis or bone loss, always ask, can this affect your bones? But I think it's something for everybody to know about. Anything that affects serotonin is going to can increase bone loss. But the thing is, not that everybody can just get right off. And he said the one time, never, ever get off if someone is suicidal. But in general, there are other methods. And that's what Dr. Neustadt talked about, to try to get to the root cause, like we always do with the bones, but to get to the root cause of the depression. There can also be physiological root causes as well as, psychological things, but there's other ways, and just know that this could be negatively affecting your bones, which, well, you can answer that question. Is that something that physicians typically talk about as one of the side effects?
Unfortunately not. Although I have to confess that I don't prescribe a lot of antidepressants to my patients. I have a lot of patients who've already been on them by their own physicians. I think also you have to remember that depression comes from a lot of different reasons, and health issues are certainly one of the compounding reasons. As you mentioned, sleep is another good one, and perhaps this environment, family. As you say, even if you have like gluten, like I had, issues, I think if we don't feel well, our body's not going to react as well as it needs to. Okay, number 2 on the list of medications, which was another one which some people know about, which is about the proton pump inhibitors, which are really for heartburn kind of things. And I have a good number of my patients who also are on these kind of drugs. Marge, I'll leave it to you to talk a little bit about that.
This is a really big problem, and Dr. Neustadt talked about this as well. This is huge because there are a lot of people who are on the proton pump inhibitors, and that's the Nexium. Those are all those antacids that people take. And the problem is they were only meant to be short term, but people are on it for extended periods of time. And it does a couple things. First of all, it depletes your minerals, as the magnesium, vitamin B12, ferritin. And people who are on it for over 4 years, they found a 60% increase risk of hip fractures. So this is huge. This is so huge. And we need our stomach acid, quite honestly, to absorb nutrients. So when we get rid of it, there's tremendous negative effects on our bones. And it was also very interesting because he said if someone absolutely has to be on that they found the histamine 2 receptor antagonists, such as Pepsid AC or Tagamet, they have not found the negative effects. So if you have to be on one of these, those would be medications to take, but also the same thing, that there are other ways, other more natural ways to treat heartburn and, acid reflux, et cetera. So it's something that we talk about actually in the summit. But I think for people to know, because the holidays are coming up and, people are eating all sorts of things that could cause, really cause more heartburn, indigestion, et cetera, that would cause them maybe to take more of these. So just be aware that this is not a good thing for your bones. And moving forward, you do want to figure out what may be the root cause and there are other treatments that are very effective.
I think it's very important to remember that there are real reasons to make sure you have lower stomach acid, especially when it can cause refluxing up into the lower part of the esophagus. And if you do that for long periods of time, you can get scarring of the tissue there and even esophageal cancers. So it's not just good enough to say, well, I'm not going to take it because I'm worried about my bones. You just need to find alternatives. I know in our family, we found Manuka honey, as I recall, was helpful for my daughter when she had some significant heartburn, but I'm not prescribing Manuka honey for everybody, but I think you need to speak to your physicians about that. And for those who absolutely have very little choice, then they need to follow you closely and check on your bones. Truthfully, there are ways you can monitor patients. The other thing I think, remember, that Margie did say was that the stomach acids do help you break down the food that you're chewing. And if you don't chew it well and you don't get the good stomach acids in there, then it doesn't break down to the particles you need well enough to be absorbed and then to be transported from that point onward.
Yeah, I mean, we need our stomach acid. A lot of people don't realize that. And that's your first line of defense also. We need an acidic stomach for bacteria and different things. So very important.
And then the third thing on that list is steroids. And steroids come in lots of different flavors and types, and specifically either oral steroids for inflammatory conditions, as well for asthmatics who have these inhalers that we've been using for the last couple of decades, which have steroids in them as well. They're very important for lots of different reasons, but they're definitely pretty well known as a risk factor for osteoporosis. Can you want to go through a little bit on that, Marge?
Yeah. So this is still part of the same talk that I learned from Dr. Neustadt. And it's actually, so for anyone who signs up for the summit, this talk is available now. It's one of the early, there's 3 talks that that I've released early that people can listen to. But the important part for everybody listening to this is that it's been known that when people are in long-term steroid use, they do have issues with their bones. And that's a known risk factor. And they found even like 200 times increase in fractures and problems with osteoporosis for people who are on long term. But recently, he said also a study was done showing that even short term can cause for a short period of time afterwards a reduction in actual increase in fractures. But the interesting part about that, it's not something that would show up on bone density. It's because it reduced muscle strength. So it made it easier for people to fall. So I just thought that was very interesting. And again, something root cause. If you can figure out other ways, some people obviously need this short term, but if you can figure out what the root cause of the problem is and other ways to reduce inflammation, and that's the path that you would really like to go.
So when we go into root causes, there's one of them that I think a lot of doctors tend to kind of let slide to the side, which is about the parathyroid hormone. And I got to confess that it's not one of my areas of expertise. I learned about it a long time ago and kind of said, thank you, I don't have to go and worry about that too much with my patients. But turns out I do. Turns out that some of the laboratory values that I heard from one of your speakers, Dr. Boone, kind of changed some of that paradigm a little bit. And I know you want to tell us a little bit about that experience, because I think that was one of the highlights for us, was really that medical insight, because she's the one who's taking and doing the surgeries on these patients all the time, and she sees the long neglected patient and their consequences.
I learned so much from this lecture. And so Dr. Deva Boone is a parathyroid surgeon, and that's really the only treatment. So if someone has a parathyroid issue, they're very small and it's a tumor and it has to be removed, which can be done. And I've seen this personally with patients. I've had several patients who found out, and it wasn't until years later that they found out. Meanwhile, they've lost so much bone. That's the problem. And I'll explain that in more detail, what I've learned from Dr. Boone. But once the parathyroid was removed, everything improved. And that's the exciting news, that if this is one of the root causes, the treatment is surgery. And afterwards, though, things can go back to the way they were. So it's really exciting because it affects your vitamin D, your calcium, the parathyroid glands. But so here's what was interesting. What Dr. Boone said was that in medical school, it's not taught. They teach you that if it's a little the calcium, so when you're looking at your lab values, if your calcium is a little elevated, you can just follow the patient. You really don't have to worry about it. She said that's absolutely not correct, because usually an elevated calcium means there might be something going on with the parathyroid. And if that's the case, it needs to be evaluated. I mean, truthfully, anyone with osteoporosis, and according to Dr. Boone, should have that hormone looked at, the parathyroid hormone. But regardless, that if there's elevated calcium, you need, even if it's a little bit, even if it's just a drop, you need to have it evaluated. And what she had said is that a lot of times people just wait because they don't think it's a big deal. And then you're losing bone. You're losing bone for years. So this could be a major, major cause of osteoporosis that's not even looked at. She also talked about what the values were. And she said they have a large range on when you get your standard lab report. So it may say normal when you get your parathyroid hormone, but it actually isn't. Like, there should really be different values for a 50-year-old versus a 40-year-old. And I'm not going to go into all the details now, but that will be, it's part of the summit. But I think the important thing to know is this is a root cause. And even with slightly elevated calcium, she said most doctors don't appreciate, people will have symptoms, and the symptoms could be fatigue. You can't focus, can't sleep at night. So if this at all sounds familiar or problems, make sure to get your parathyroid gland, your parathyroid hormone evaluated, your calcium, but listen to the talk, because she actually gives the exact numbers. And I think this is something that she said, as a surgeon dealing with this, is missed. And I just think how sad that is, that people could live a few years not knowing about this and yet lose a tremendous amount of bone. So I thought that was very important, and something that could, because as I said, I've seen several patients in my, that I've worked with that found out years later they had this, and it was wasted time.
And just in case some of your listeners, excuse me, aren't really familiar with the parathyroid gland, there's 4 little circular spots that have the glands, and they're right near the thyroid, hiding behind it. And they're responsible for releasing one of these hormones called PTH, which is parathyroid hormone. And that hormone triggers, it kind of balances your body's amounts of calcium in your bloodstream. And when you don't have a lot of calcium, or your body thinks it doesn't have, your PTH will go up and will ask you to take the calcium out of your bones. So at least you understand a little bit better about what it was. And I know Dr. Boone's going to give you a much better education than I can about it. Now, we are flopping around topics, but this is one of Margie and my favorite topics to talk about. And it really came to the forefront in my office just the other day. I had a very pleasant lady in the office. She has osteoporosis of her spine. And we were talking about her exercise program. And she was very, very proud to tell me that she's doing yoga. And I said, "Oh, that's wonderful. Great. I'm glad you're doing yoga. What are you doing?" And she starts to tell me, and she says, "The thing I'm most proud of is I can touch the floor standing with knees rigidly locked and put my palms on the floor." And I looked at her and I said, "Oh, Margie, you want to tell me why I said, oh?"
Because you've been brainwashed by me to know what are some of the contraindications for anybody with osteoporosis. And one of those is forward bending and rounding of your spine. And the reason that is there was a study done years ago It was actually back in 1984 at the Mayo Clinic, which they'll never repeat. But they looked at 59 postmenopausal women who had osteoporosis doing different exercises. So they looked at people going backwards, doing extension exercises, which is really great for you. And they found there was a 16% fracture rate. Then they looked at people doing forward bending only, rounding out, 89% fracture rate. So of course you see why they would never repeat that. But the reason is it's the front of the spine where most of the fractures occur. It's not the back. And so when you bend forward, all the force is going on the front of the spine. And a lot of times then the vertebrae, instead of being square shaped, become wedge shaped. And that's how you get a fracture. So the forward bending, that rounding, is actually increasing your risk of fractures. So not that you can't do exercises, you can do everything. But if you do yoga and Pilates, the key is you want to maintain your inward curve in your back, and you're bending like hip hinging. You're bending from the hips, not the waist, and not rounding out. So I think it's really important. I see seniors exercising all the time, doing all the rounding and all of these things that really are putting them at risk for fractures if they do have, osteoporosis. So I think that that's something that's so important. And in the summit also, I have so many fabulous physical therapists who really are the people who train the physical therapists. There's Sarah Meeks and Sherry Betts, and people who really are leaders but teaching what's safe, what's not safe, and also at what can be done. But I think and besides just rounding and doing that, posture also, because that puts you at more risk for fractures too. So exercise is so important. Doing the right exercises is critical. So yes, so that we could talk 2 hours.
Oh, we do all the time. As a matter of fact, unfortunately, maybe over dinner and other times of the day. Now, I'm a big proponent of physical therapy, obviously, and I use it liberally in my practice. But when it comes to my patients with osteoporosis, I have a decent idea about when I would like to send people for physical therapy consults. But tell me your thoughts about it, and how do we decide which patients would be appropriate to be seen by a therapist?
Personally, I think every person who's diagnosed with osteoporosis should see a physical therapist if they can, if it's possible, because everyone's different. There's not one exercise that fits everyone. And so often it's so sad. People will just, see exercises online, or just say this worked for their friend and they'll do them. And it's not appropriate for everyone. And also you may have some restrictions, that will impede your exercise program, or pain, or you're doing things putting too much force on one area versus another. So if you have the option, see a physical therapist who has experience with osteoporosis. That's important, because not everybody has the training. And really, they will give you an evaluation, and then they will custom design a program especially for you. So I think in general, physical therapy is not utilized the way it should. So many people think, oh, my shoulder hurts. Well, I just have to live with it. Or I have arthritis in my knee. It's just from age. Get it evaluated. So often there's help. Why live with pain if you don't have to? So that's my thought, that to utilize physical therapy, see the right people, and I think it can make a huge difference.
And I want to underscore that point a little bit more, because I certainly all have patients who have other health problems, or have, I say, joint problems, knee problems, or foot, or something else. And they are trying to do exercise. They're trying to take walks, or go on a treadmill, or trying to do on a Peloton or something like that. It's well-meaning, but a lot of times they're hurting themselves. And I know, as Margie was saying, at least I've learned that from her, that's why I think it's really important to have somebody watch what you do, who knows what they're doing, and give you guidance to protect you. Because the worst thing you could do is come to your doctor injured because you were exercising.
And the other thing about that is oftentimes the doctor won't prescribe it. And not that not that they mean harm, but they may just say, oh, make sure, typically do weight bearing and strength. They may even say strength training, or they may not. They may just say, oh, do walking, and that's not enough. That's also, not enough to really, if you're really trying to make changes in your bone density, or, the walking itself is not enough. Anything's good, of course, but they may not. Right, you're going to have to ask and be the advocate and say, you know what, I just don't know exactly what to do. Is it possible to give me a prescription for physical therapy so they could help me or whatever? And usually they will. It's just something they didn't think about.
Right. And some doctors will hand you a little piece of paper with some stick figures on it too, and say, try some of these exercises. And once again, I think supervision, especially on the front end of this, will give you so much more benefit at the downside of that.
You're
It
right.
has to be
Even
better.
one time, even a one time, it's not like you have to go for weeks and weeks. Even one time going for an evaluation, then see where you're at, and the therapist can assess what you need.
And I have a good therapist. She won't do work on me unless only time she'll help me out is if I've been behaving myself. If I'm bending over the wrong way for a while, I'm not getting the help because I deserve it, right?
That's not true at all.
I know, not always, but I try to work out and work in office and tell all my patients they got to do the right stuff. Now we are talking. We have gone through a couple of the areas, but the last thing on my list today of conversations was about, we're getting towards holiday time, and this obviously has been a very, very challenging year and a half to 2 years for almost everybody. I don't know anyone who hasn't been experiencing stress and strains and all kinds of uncertainty in their lives, and it's really difficult for all of us, no matter who you are, where you are, and what you're doing. So, Margie, stress. Can you help us on that one?
Yes, and we've discussed this before in the podcast, but it's just, you can never talk about it enough because the stress hormone cortisol causes reduction in the bone building cells, the osteoblasts, and it really has an effect on our bones. And people just, I see this all the time. Everyone's so worried about what they're eating, what they're exercising, and they don't realize that the stress itself is a huge risk factor and a big problem. So it's very important when we're looking at a complete exercise program to figure out what works for you in terms of stress, reducing stress. We're not going to change, life's stressful, but what practices can we put in place to really make a difference? And that was really exciting on the summit. I made sure to have some just really great speakers discuss different possibilities. And two of the speakers actually talked about problems from childhood. If you've had trauma early on, or if you've had it's called ACEs, adverse childhood experiences, that can still be causing a problem, and it's never too late to deal with them. And so Dr. Keisha Ewers was really talked about this, and what's good on the summit is she actually takes us through a process. So I wanted tools on the summit that when you listen, you can do. So it's not just, oh, yes, I have to deal with that. Right there and then you get the tool and you can learn a practice to do, as well as Danny Williamson. She also gave us some good things to do but the stress, we have to figure out what works, each one of us, what works for us and what tools that we can use to reduce the stress, because especially now with the holidays coming. And I think whatever works for you. I always start people on breathing or, and me, I'm big into all the happiness work. And that's another thing. My mentor, Marcy Scheimoff, who was one of my mentors, who's really a happiness expert worldwide. So she's one of the speakers on the summit, and we have a great discussion on happiness. And that's also released now too. So people can listen to that as well. And this is free. So it's not anything you have to purchase, but you can just get all this now. So
now, Margie, one other thing I want to mention to your audience, that when you mention cortisol for stress is also, cortisol is a steroid. So when we were talking before about steroids, as a medication, your body has steroids too. And so the point I think Margie's trying to make is you need steroids for a little bit of your body, but you don't need a lot of it. And when you get that stress, you're going to pump a lot of it out. Now, one other thing I just asked Margie about, which is any thoughts on how you deal with those irritable family members and cousins and people who just kind of have that negativity or that kind of thing? How do you suggest we get through them?
Okay, well, this isn't in the summit, but I teach this all the time. I teach this all. No, that's okay. I teach this all the time, and I think it is important. I'm glad you brought it up, because I think this something happens at the holidays where, the problem is emotions are contagious. We have something called mirror neurons in our that mirror the emotions of other people. So you can feel it when someone's so negative. It unfortunately has an effect upon you. So what couple things you can do. So if you're at the holidays, sometimes you're forced to see relatives or people that maybe you try to keep your distance from. I mean, hopefully not, but this does happen. And they just can complain and complain, and they just keep looping the same problem. So what you do is you make boundaries. And what you say is, okay, after a couple of minutes, so let's talk about solutions. Just get them out of that negativity. You can listen for a couple minutes, but that's it. But then stop and, I see that really is a problem, but let's focus on solutions, or just try to, keep a boundary, only listen to it for a certain amount of time. The other thing you can do, and you can start practicing now, is just like when you have a cold and, or you don't want to get a cold, you do things to improve your immune system. Well, you can do the same thing for your positivity immune system. And so if you do practices like looking for the good and so many of the things that I've taught on this podcast as well, but if you do practices for yourself where you're really upgrading your own happiness, then you're going to be, if you're feeling good and positive, it's not going to affect you as much. So you want to get your own system as good as you can. And then the other thing that really helps is just sending out good wishes. If you're there, and the other thing I like is filling yourself. This is one of my techniques, filling yourself with white light. So you enter a room, because where there's light, darkness can't enter. So if you're entering a room with people you don't know about, fill yourself with white light and just send out good vibes. And so I would say those are my favorite ones. And I had to, as a physical therapist, sometimes you work with patients who are very negative, and you're touching them, they're right near you. So I've really had to practice this, because actually there's been time. Why don't you share it? It's funny.
I come home from work sometimes, and Margie she'd be off. She was just irritable, and I don't know what was going on. I look out and I'd say, "Did you see so-and-so today?" And she'd go, "How do you know that?" I said, "Because every time you see her, you come home and you're just out of sorts."
This is true. This is when we lived in Chicago many years ago. But
Yeah.
there was one person who just had such, it's the stronger. People ask, well, who wins? If someone's really negative, someone's really positive, it's the stronger. It's whoever's stronger. And so, like, if you're with the Dalai Lama, then the positivity is going to set in. But anyway, yeah. So I would have to. And then the last thing, if you absolutely have to do, is like make a physical shield so that you don't absorb it. But they really work. And it's just a matter of, making the boundaries and noticing it, and don't let yourself get caught into it. And I think the other person appreciates when you switch to more solutions versus focusing on the problems.
Just a little point. If any of you wonder, yes, Margie is as happy as she seems on the air. And she makes me really happy, and our family is full of a lot of positivity and energy, and we do the practices in our home, just so you know that. The other thing I wanted to state was that I'm not so sure Margie's much behind the Dalai Lama in her force of happiness and power. So when you mentioned him, I think that there's two of you out there who are big forces here. He's the East and you're the West, as far as that goes. Anyway, I just wanted to say also that I've been watching Margie for a zillion years. I've been married for a long time. And the summit that's coming up is so special to her. It's been her mission all these years. All she's dreamed about was coming on the air, finding experts. I mean, she's combed the earth, finding people. A lot of them came on the show. Some of those people from other places weren't able to come on, but I can assure you that her heart and soul is all in this affair and this whole summit, and it is a worthy endeavor with wonderful guests, a lot of really interesting information, and I do hope you at least take the time to listen to some of the guests, because I know you're going to get something out of it, as you always do when you hear Margie on her blog. So thank you, Margie, for all your efforts. Thank you for finishing this up, and by February I'll get to see you again. And
thank you for coming today. And that was very kind of you to say all those kind words. And and yes, it's true about the summit. For everybody listening, I'll have the links in there. The links are below, and you can just, click on and really you'll get the 3 interviews right away, but it's free. There's tremendous amount of information, and that's my mission. My mission is really to change the trajectory of osteoporosis. So not only is there information for all really for all ages. I even have a pediatrician who's come on what we can do with our kids for future generations. So there's something for everyone in there, with the 46 talks. And there's so many things. So yes, I'm really excited about it. And I hope that, for those who are interested, that you do listen, and I'd love to hear your feedback moving forward. So thanks so much. And thank you so much, Craig, for coming here and sharing this information with everybody.
Thank you, Margie.
I hope you enjoyed my interview with Craig and now have some new information that can help your bones and overall health. I really hope you join me on the summit because there's so many great speakers and more information. And also, when I did the interviews, I had people actually go through practices with you. So you'll see exercises and practices you're able to put into your life that can really make a difference. So sign up. You'll get the 3 talks right away. And otherwise, it starts on January 17th. So really excited about it. And thanks for listening today. And I look forward to seeing you on the next episode.